Infectious Disease Reference Guide for Designated Officers. Section 3. Infection Prevention and Control. Personal Protective Equipment. Personal protective equipment, or PPE, creates a barrier between the infectious source and an emergency service worker. PPE is considered to be single-use and should be removed and discarded after use. Gloves are to be worn when there's a risk of contact with blood, body fluids, non-intact skin, mucous membranes, and/or contaminated surfaces. Hand hygiene must be performed before and after glove use. A gown is to be worn when there is a risk of splattering or spraying of blood and/or body fluids. Does not include uniforms, lab coats, and/or jackets. Protective eyewear is to be worn when there's a risk of splattering or spraying of blood and/or body fluids, or being within 2 meters of a client with a cough. Does not include personal eyeglasses. A mask is to be worn when interacting with clients within 2 meters who have respiratory infections spread through droplet transmission, or when there's a risk of splashes, sprays of blood or body fluids. If tolerated, it should also be worn by clients with respiratory symptoms during transfer or transport. The N95 respirator is to be worn when in contact with or caring for clients with airborne infections, for example, tuberculosis or SARS. It must be fit tested at least every 2 years to ensure a proper fit for full protection. Here's how to put on and remove personal protective equipment. First, use alcohol-based hand rub. Next, put on the protective gown with the gap in the back and tie it around your waist. Then, put on mask and shield over your nose and mouth. And finally, put on the latex-free gloves. To remove the PPE, take off gloves, turning them inside out as they come off. Remove gown. Use hand rub. Then take off the face mask. Be aware of the location of personal protective equipment in your workplace.